Why are nursing classes so much harder than other classes? Why is nursing school so hard compared to all the other majors? Yeah.
For real world answers to all of your questions on nursing school and life as Dr. Wife.
Nursing school is very tough because the classes are very tough, and they're not like high school classes or even a lot of gen ed classes. And a lot of that is because of how much you're covering at one time. You think about it, you're learning about every condition, every disease, the treatment of all of those, how the body works. It's very complex, and even though we know so much about the body and so much about common conditions, we're always uncovering information about the body and about new diseases, new conditions, how treatments work, new medications. And so just the sheer volume of information that you're expected to not only recall but understand and be able to apply is just a lot. So it's more than what you would ever have to try to remember in a history class. If you think about...
Historians, don't send us nasty emails.
I know. Sorry, history class.
I mean, history class, is that even ever changing?
Well, yeah.
They only have to have something for every day on Earth and before.
It's just the constant evolving new information.
That's true.
It's very overwhelming trying to keep up with all of that.
Yeah, it's overwhelming for me just watching you guys try to keep up with it.
Yeah,
that's a lot.
Yeah, I mean, that's one part of it. But then there's the psychomotor skills element of nursing school. So now you are learning skills that you've never done before, and it takes hours of practice to get good at. And so you spend a lot of time just feeling a lack of confidence in doing nursing skills. And a lot of students will say things like, maybe I shouldn't be a nurse. I don't know how to start an IV. I don't know how to do this skill. I can't figure out how to do this skill correctly. And so that's very frustrating and intimidating, and oftentimes your grades may be attached to that. You'll have to pass checkoffs where you'll have to show competency in skills, and so now that's part of you being able to progress through the program. So that's really hard. So the content, the psychomotor skills, the critical thinking that's involved. So now you're taking tests that require you to apply your information that you've learned, and so much critical thinking is expected of you. There's also the nursing process, and if you haven't learned about that yet, you will. And it involves critical thinking at every stage. So assessing, diagnosing, plan, implementation, and evaluation of your patient care that you're giving. And that is very complex, a very complex process that involves a lot of critical thinking to do it well. And of course, you want to learn how to do it well because you are going to do this every day as a nurse. You're going to follow the nursing process. So, and then if that wasn't enough, nursing school's tough because you're expected to do it all with a good attitude.
Yeah. Well, I say expected. I've seen some bad attitudes in my students.
Well, you can...
All students.
You can have... I mean...
Not history students, though. They have it so easy.
No one is perfect, but nursing is a profession of service. So if you are providing a service to patients, they're going to expect quality patient care, and they're going to expect their nurse to be caring and compassionate and competent, and to be able to provide care that's good customer service. And so that expectation means that everything that you're doing it with this attitude of, I want to do this, I want to take care of you, I want to serve you, I want to be a caring nurse. And so all of that really sets this major apart. So it makes it very difficult because it's very hard to maintain that good attitude when you're very overwhelmed and you feel just kind of buried in the information you're required to be able to remember and use.
That's a great answer. My gosh, listening to you talk is a energizing process.
Wow.
It is.
Think you want to sign up to be a nurse?
No, mostly because I'm not compassionate like that. I just don't have...
Nursing school won't feel so tough. Helping others won't be so rough. You are confident, compassionate, and so much more. But sometimes it feels like you're not too sure. So when